So let's talk about vitamin C in an IV. You
Right.
can't absorb enough vitamin C.
Right. And also, if you're taking anything orally, you're getting like 15 to 35% of the benefits from it. And there's negative side effects from that, like heartburn and upset stomach. So, at Zen Infusion, we didn't invent vitamins. We're just doing them differently. So by taking them IV, you're getting 90 to 100% directly into the bloodstream. And something I didn't realize when, I started the company and began the research was all the medical journal reports that have been done on IV vitamins, and especially high dose IV vitamin C. The health benefits are really remarkable. So just the fact that they use them in burn units, in oncology, for rheumatology, every category of patient, whether you're a healthy patient undergoing a surgery or you're struggling with health problems, there are amazing benefits to high dose IV vitamin C. One of the journal studies showed while a vitamin can't cure a disease, high dose IV vitamin C they found in oncology patients, it was putting a protective coating around the cells that are mutating and dividing. And so by taking high dose IV vitamin C, it decreases inflammation in your body, which is the root cause of so many disease processes. So in the study, it showed that oncology patients were living longer in less pain and having a higher quality of life when they took high dose IV vitamin C. And the oral takers, they noticed no benefits of such.
And oncology is cancer patients.
That's correct. Yes.
So you're saying that inflammation is what causes a lot of diseases?
Certainly contributes to a lot of diseases. Yeah. Heart disease in particular.
Everybody's got inflammation.
Yeah.
You live long enough, you've got inflammation.
You do.
That's why everybody can benefit from IV vitamin infusion. That's why so many people are taking anti-inflammatories orally all the time, which can have negative side effects.
I am surprised that dermatologists are not recommending this IV drip for all kinds of skin problems. My 90-year-old father-in-law has had itchy skin rash on his skin for 2 years. He puts topical creams on it, can never get it to go away. He comes to you and it's almost gone.
A lot of people, if they have not witnessed that, especially physicians, would say, I don't know about that. There's probably a lot of other factors at play. There may not be, but I think sometimes you just can't quantify these things. But I can't quantify. I couldn't quantify how it would benefit my surgical patients before I actually saw it, and then it was them convincing me. It wasn't anything that I saw. It was them like, oh my gosh, this is the second one of these I've had by you, and it's just been a whole different operation, a whole different experience.
Did something in your life happen, and you were like, this worked for me so good, I've got to share it?
Well, yes, I went through treatment for breast cancer. I had been on immunosuppressives and biologics for 20 plus years, over 2 decades, and they have side effects of cancer. And so I truly wanted to look for something that was great for health and healing after I went through all those health struggles. I started seeing other companies around the country, not in Little Rock, Arkansas, but around the country that were starting to do vitamin infusions. So just looking at some of the medical journal studies done on it, I was like, why is no one doing this here? Like, I don't get it. We need to focus on health and healing, getting off of these medications and decreasing inflammation in our body.
Are you off any medication? Were you able to get off medication?
I'm off all of my immunosuppressives and
that
biologics.
That you took for 20 years?
20 plus years, yes, which is amazing. And so, yeah, it's quite remarkable. I even, for the first time in decades, have been able to skip colonoscopies because I'm doing so great. My GI doc woke me up after a procedure and was like, so what are you doing different? Like, what are you doing? You look great. It's all perfect. And I said, I'm doing my high dose IV vitamin C. And she said, yes, I've read about that. Keep doing what you're doing. So you should never get a colonoscopy without doing a vitamin drip the day of your prep because they're going to overdose you on laxatives. So this is game changing. We'll give you vitamins, minerals, amino acids, and anti-nausea. It'll be the best.
The day before or the day after?
You do your prep. When they overdose you on laxatives to prep you for the procedure.
Yes, you have to drink all the laxative and then you get dehydrated.
Yes.
So you're saying you should do an IV?
Right. Like if you start your prep at noon, you can do your vitamin drip at 10. If you start your prep at 2 or 4, do your vitamin drip the same day prior to. It is life-changing for the better.
It is.
So, yeah.
I can testify.
Yes.
That is a good tip.
Yeah.
Yeah.
It is.
Everybody has to do a colonoscopy.
At some point.
Thank you, Katie Couric.
Yeah.
Right.
Really.
If you enjoyed this video, be sure to check out the full interview on the right side of the screen. Want to see more of Kerry's interviews? Subscribe to our YouTube channel to stay up to date with all of her latest shows. And as always, thank you for watching.